Hey everybody, I'm Dr. Brett Smith. I'm a rheumatologist and internal medicine or primary care physician. I am the owner and physician at Tennessee Direct Rheumatology, and I want to spend a few minutes today talking about why direct care and also why the name Tennessee Direct as well. So the first thing is typically it's more time. So physicians want more time with the patients. They want more time to communicate even between office visits as well, and we also believe that patients want not only more time with the physician, and also they want more access, we believe. So we believe that time is a big deal, and we offer that in the direct care model. The way we do that is typically we book every new patient for at least 60 minutes, and typically the return visits are booked for about 60 minutes. And that gives us ample opportunity to have discussions, to research during the visit, to answer questions, to go back and forth in terms of what the symptoms are and what the diagnosis might be, and even just make casual conversation too. You know, the average office visit ranges probably about 8 to 15 minutes in the traditional healthcare system. So we offer an amplitude of time compared to a lot of other models, and that's a benefit we feel like for a lot of the patients that choose to participate in a direct care model. And we really want to be a one-stop shop as well too. We feel like there's a lot of fractionation of healthcare in the sense that if you go see somebody too, you have to go to this other person to get this test done. So in the direct care model, as the owners, we're able to contract with individual companies primarily for the patient's benefit to help us do more things in clinic. As an example, you know, I'm a rheumatologist and a primary care physician, so we do all sorts of things. You know, we do strep tests, we do flu tests, we have an in-house laboratory, we run an in-house pharmacy as well. We offer many products or generics at discounted prices compared to even local pharmacies. We also offer skin biopsies for small fiber neuropathy. We do platelet-rich plasma or PRP injections. We do joint injections. There's a lot of things that we do that would typically be in multiple areas of a traditional healthcare setting. So we're very pleased to offer that to our patients to make it more convenient for them and their families as well. Faster appointments are a big deal. We do know that wait times are quite long in healthcare nowadays for a variety of reasons too, but we prioritize our appointment times and our wait times. So as of right now, most physician offices for direct care are going to run probably no more than 1 or 2 weeks for a new patient appointment. Right now, we can offer new patient appointments within about 7 days, typically in patients that are existing patients at Tennessee Direct are able to see us probably within about 24 to 48 hours. If for some reason they prefer not to have an appointment and they want to do telehealth or they want to talk by phone or email, we can do that at any point as well. So I feel like appointment times and that line of communication builds a better physician-patient relationship as well. And we're fairly fast about responses too, whether you're calling the front desk to speak with Laura or Emma, which are our nursing staff, or you're talking to me and emailing me. I'm typically going to respond to you probably within a matter of hours to 24 hours at the latest typically. So we prioritize our response times in the direct care model. Also control of pricing and labs. That's a big deal. So in our model too, we contract with companies like LabCorp, and we buy products wholesale and we provide them back to the patients. Most of our labs probably average between $5 to $7, which is usually substantially cheaper than what it would be in a traditional healthcare system. So we feel like we have a variety of offerings that we can give to people to help with keeping their laboratory costs down. And the lab is in-house as well, so you can come to the office and we can do your laboratory studies anytime rather than having to go to a different facility. We also feel that it's a personalized approach too. Given the ample time that we have to spend together, we can form a personalized approach to help with what your priorities are and what we feel like would be a good way to help you achieve your goals. And I think that personalized approach is unique to direct care. So we're very particular about offering that to our patients and for potential patients as well. We have opportunities to listen to you and to hear you out and just sit with you and understand your point of view and where you're coming from to help you craft where you want to be and help you achieve your goals. We also want the decision for what's medically appropriate to lie solely with the patient and the physician to make a mutual decision about what's best in the circumstance too. And the way we do that is we typically operate outside of insurance networks. And how we do that is that we charge a monthly fee depending on the age of the patient that allows the patient to be in the practice, and that allows the decision making to be between just those two parties. So patients can still carry insurance, and they can use that insurance for things like hospital visits or surgeries or even laboratory studies and medications if they choose to, but we operate outside of insurance and direct care models. So people might also wonder, what's the difference between direct care and concierge medicine? And it could be a little bit of minutia, but concierge medicine is typically a much more expensive service. So typically there's a retainer fee that can be anywhere from $1,000 to thousands, over $2,000 to $3,000 per year, and that is billed to the patient or the family in addition to billing the insurance as well. So in direct care, our price is typically lower than the concierge model, and we do not bill insurance. So there are no deductibles, no out-of-pockets with us. Our monthly fee is the only fee that you see for the services provided. We wanted to use the name Tennessee Direct because we wanted to communicate directly to the patients that we're working directly for them as a direct line of communication between the physician and the patient. So we call ourselves Tennessee Direct. So we have Tennessee Direct Rheumatology, and we also have Tennessee Direct Endocrinology as well. So we offer rheumatology services and primary care services, I do in particular, and then also my wife Sarah Smith offers endocrinology services as well. So the name is to just simply imply that we are working directly for you and we are having direct access to the physician. So in closing, we want to communicate that at Tennessee Direct, we are a direct care practice specializing in rheumatology, primary care, and also Dr. Sarah Smith practices endocrinology. We are working directly for the patients, and while we do not accept insurance for office visits too, we do believe that the amount of time that we invest in the patients for visits and communication and access and the other savings that are available in the practice do make the services worthwhile. So we'd love to hear from you. If you have a question, please give us a call. It's 865-327-2084. Our email is also info@rheumatologydirect.com, and our website is rheumatologydirect.com. If you have any other questions, there's plenty of information on there, and we'd love to hear from you. Thanks for watching.